Hey everybody, it's Dr. Jarrett, spell out Dr. J-A, 2 R's, E, 1 T. I'm back again. I told you last week I would be here giving you a few more updates on a lot of things going on. I've been getting lots of calls about Lyme disease this week in the last couple of weeks, and people concerned about Lyme disease. What is Lyme disease? Is that what happens when you eat too many limes? Hey, Dr. Dre, good to see you today. Thanks for joining us. No, it's not when you eat too many limes. It's actually an illness that you can get when you have a Lyme carrying tick, which is one of those things. Hey, Jody, how you doing? It's a bacteria that the ticks have that actually can make them sick. So one of the things that you want to do is make sure you don't get ticks. Lyme disease is important because it is a treatable disease, and let you know that you actually can have various symptoms from it. One of the more classic symptoms is a rash that you can get that's caused by a bullseye lesion. It's called a target lesion. So it really literally looks like a target on your skin around the site of the bite. That usually doesn't happen for some time after the tick was on you. But if you see something that looks like a bullseye or a target, you should make sure you get to your doctor to get it checked out. One of the other things that I wanted to tell you and let you know that you really should make sure that you don't get these ticks at all, because Lyme disease can cause headaches, it can cause more severe neurological symptoms, tiredness, joint pains, a lot of things as the case gets more severe. So make sure that you're doing everything to identify the symptoms early. It can be treated with antibiotics, and go see your doctor. Now, I said that Lyme disease is caused by ticks. It's one of those things that you should make sure that you stay away from ticks. Ticks, especially in the Northeast, I'm currently in Pennsylvania, and the north central states tend to carry Lyme disease. So ticks like wooded areas, grassy areas, years that are particularly moist early in the spring like it was in the Northeast, sets you up for a bad tick season. So one of the things that you're going to want to make sure you do is just stay away from ticks. There's a few things you can do to take precautions. If you're in a wooded area, wear long pants, long sleeves, put a hat on your head. That keeps the ticks from falling on you and attaching to your body. One of the other things that you make sure that you can do is add an insect repellent to your skin that is exposed. DEET, D-E-E-T, gets a bad reputation sometimes, but it's actually very effective in preventing ticks and other insects to get on your skin. So you want to make sure you use up to about 30% DEET in your insect repellent, and that is safe for children. Furthermore, if you identify a tick on your body, now deer ticks are very small ticks, so they look like a little speck on your skin. So make sure you're examining your kids and making sure that they're okay. But find that little piece of tick. You'll take a fine pair of tweezers and get those tweezers as close to the insertion point of that tick onto your skin and slowly pull back. You will find all types of different methods for removing ticks, but that's still the most recommended one, because many of them can be dangerous. Try not to squeeze the tick as you're pulling it out, so be very gentle with some fine tweezers, and that should take it out. After you've taken out the tick, then you wipe that area with alcohol. You should be good to go. You can put a little antibiotic ointment on as well if it looks irritated. So, best thing to prevent Lyme disease is to prevent getting ticks. If you do get a tick, remove it with a fine tweezer. If you notice tiredness, joint pains, muscle aches, headaches, or that target lesion that I described, that target rash that you might see on the skin, make sure you go see a doctor right away so that you can be evaluated for Lyme, which may include a blood test, and treated for Lyme if you do indeed so have that. So, thanks for joining in today. Again, it's Dr. Jarrett, J-A, 2 R's, E, 1 T. I'll be back at you later in the week with some more helpful tips. Make sure you go to my Facebook page, Dr. Jarrett. like my page. You can follow all the happenings with Dr. Jarrett on the page. You can also follow me on other social media at Dr. Jarrett. So like my pages, like my statements. I'll keep this coming. If you need it, you can find me on the YouTube channel. Go to that Facebook page, like it. If you have other topics that you'd like me to discuss, leave that on my Facebook page. I'll be happy to get back to you. So again, Dr. Jarrett, J-A, 2 R's, E, 1 T. You can find me out there. Thanks for joining in. Take care.